I'm Christine Lawler from the Peaceful Mind Counseling Center, and today we have Dr. Bennett with us to answer some of our most frequently asked questions about the ketamine process and what that looks like. So thanks for joining me.
Yeah, absolutely.
Okay, so first of all, just tell us about ketamine. What is it? How did it come about? And how does it work?
That's probably the most common question I get. So ketamine is an anesthetic, first and foremost, and it was first synthesized in the 1960s, and it's been in common use since then. It literally has millions of uses worldwide. It's used in every hospital in the world, and then it's also branched out into other areas. For example, it's very frequently used in veterinary medicine. So, I get the question all the time, well, isn't this a horse tranquilizer? It's like, well, technically yes, but it's used actually more with humans than with anything else. About 25-ish years ago, psychiatrists started to look at it because there were some case reports that patients with severe depression, particularly with suicidal ideation, were coming in and reporting that, whatever, they'd gone to the ER, they'd broken their arm, something bad had happened, they'd gotten ketamine, and then for days following, they had this very profound antidepressant effect. Their suicidal ideation was improved. And this was happening enough that formal studies started to get put together looking at it. And the research has been very, very promising, showing that patients who have severe suicidal ideation, who are actively trying to kill themselves, they go through a round of ketamine therapy and their suicidal ideation rapidly declines. I mean, and I see this all the time. I've had patients who've come in who've said, I've wanted to kill myself for 15 years, and within 2 to 3 weeks, it's gone. Faster than even a traditional antidepressant will even start to have any effect, their suicidal ideation's gone. So it's, in fact, my opinion is that going forward in the future, I think it will move to first line for patients who have really severe symptoms like this.
Yeah, I agree. I've been a marriage and family therapist for 15 years. And that's why I became so passionate about it, is seeing these long-term clients that have really struggled, that, they're doing everything. They're practicing every skill, every tool. They're committed to therapy. They're doing all the things, reading all the books, and they're still just stuck.
Mm-hmm.
And I had a patient that I just barely sent to you that had thought about killing herself every day for 12 years. And after 2 or 3 infusions, she was like, I haven't thought about killing myself in 2 weeks. Like, this is crazy. That's never happened to me before.
Yeah, quite frankly, before I got a lot of experience with it, I almost wouldn't have even believed how effective it was.
Totally.
Like, to have someone come in, they've been struggling for years, and then all of a sudden it's just poof, it's gone. So it's been really impressive. And I mean, you can imagine like the massive change in quality of life people have, where they have this incredibly heavy burden on their shoulders for sometimes decades, and then within a few weeks it's lifted. So it's really a life-changing treatment.
Yeah, it truly is. It's really amazing.